Well, thank you, Rob. That was a really nice introduction, even though it was just my bio that I've heard. Just the way you spoke, it was so nice. Your enthusiasm, thank you. And hello, everybody, and thank you to the Pain Society of Alberta for inviting me to speak. I wish we could all be there together. As Rob said, I'm a stone throw away. I'm in Sylvan Lake, Alberta. But yeah, unfortunately, we couldn't all be together. But this conference has been just phenomenal. I've had a chance to listen to many of the talks, and it's just an honor to be here. And I'm just going to share my screen here. I also want to just say a little something on behalf of many of my colleagues around the world who have been integrating yoga therapy for many decades. They've been integrating yoga therapy into their rehab practices, into healthcare, into pain care specifically. So we all thank you for giving us a voice, for giving yoga therapy a voice at this conference. And hopefully by the end of the presentation, there will be a deeper understanding of yoga, and we can see it through a wider lens and appreciate the value that it can provide people in pain. So I don't have any affiliations with, nor do I receive any funding from any organizations or academic institutions. I am a sole proprietor as a physiotherapist and yoga therapist. As you heard from my bio, I'm a clinician and a continuing education provider. So I do receive income from services and products that I provide for health professionals and people in pain. And I will be mentioning some of these in my presentation. And I think I have to also disclose that I am very biased towards integrating yoga into healthcare and pain care, but I will mitigate this bias by translating the scientific knowledge with critical review, including the gaps and limitations in the research. So I will try to harness my passion for this topic and not overstate the claims of yoga. So in the next, I guess, 25 minutes or so, what we're going to do is I'm going to talk about yoga and specifically yoga therapy and how yoga therapy might contribute to addressing some of the problems that we currently face in pain management. And I'll just point to the supporting evidence. And whether or not you have an interest in yoga, I think it can be valuable to learn more about it, since it is one of our most popular complementary health practices around the world. And more people are seeking yoga for their health concerns and specifically for pain and pain-related issues. And there is a growing number of health professionals that are integrating yoga into their professional practices or referring their patients to yoga. And that might be because of yoga's growing evidence for a variety of populations. And it's also being included in many clinical practice guidelines. So I will provide some tips at the end on how you might be able to safely refer people in pain to yoga and where you can learn more. And then at the end, we'll have time. I'm going to make sure we have time just to experience a brief technique. So yoga, this is, some people say 2000, depends on what you read. Some people will say it's a 2,000-year-old ancient wisdom tradition of philosophy and practices. Some will say it's more like 5,000 years old. So we're going to try to do this in about 4 or 5 minutes. It is a comprehensive health system, and the main intention of yoga is to uncover the root causes of suffering and then alleviate that suffering. The word yoga means to yoke or to unite all the layers of life, or all the layers of a human existence. So that's the physical, emotional, mental, social, and spiritual. And some of the, what I did was I pulled some definitions from some of the many yoga texts. Now, in yoga, we tend to say that yoga can't really be defined or described. It can only be experienced. But these are some of the definitions or the descriptions that we do see. So yoga as skill in action, as cessation of a fluctuating mind, as equanimity or evenness of mind, as a journey or a process of self-realization, or some of you may have heard the term self-actualization, In other words, it's an inward journey of self-discovery, and that is meant to increase self-awareness and discernment, and ultimately gain deeper insight into your own suffering, and then, of course, like I said, alleviate from that suffering. And there's many different paths and lineages and types. And for today, for the purposes of this presentation, I'm going to talk about the 8-limbed path. It is a common path that we use in yoga therapy. So the first 2 limbs, the yamas and niyamas, they can be looked at like the ethical principles, how we act in the world and how we treat ourselves. And there's a lot here. We could spend a lifetime talking about, all the 10 different yamas and niyamas, and we have a lot of the philosophy of yoga that's embedded here in these first 2 limbs. But what I'm going to do, I decided just to share really briefly a few examples of what these might be. So one example, consider the idea of acceptance of the present moment, an idea of surrendering, so not giving up, but considering what it might feel like to not resist or to fight what is the reality of the moment. And then rather bring in a compassionate and embracing, and I would say even a loving type of trust in yourself, in your body's wisdom and its desire to progress towards health and well-being. And we as healthcare providers, we are the facilitators of this process. We're guiding and we're supporting. And another example is that we use language to promote the concepts of self-kindness and self-compassion. And we're promoting things like confidence and ideas of wholeness and worthiness and resilience. So not things like fear or brokenness or fragility. And Tasha Stanton talked about this yesterday, about the importance of language and how that matters. And then also when we listen to the stories from people in pain, and we've had some wonderful presentations this weekend from Katie and Haley and Tracy today, I believe. I wasn't able to, I listened to you this morning, Tracy, but I've heard some, I'm sure it was amazing. So when we hear these stories about people in pain and what these women have shared, often people feel betrayed by their body, even betrayed by others. And there's a lot of grief and loss. We hear stories of guilt and shame and self-blame and anger. And within these first 2 limbs, there are a lot of concepts that can provide antidotes to these. And then at the same time, we're working to embrace this idea of acceptance and contentment and letting go and surrendering. We're also balancing it with effort and action and self-discipline and the courage to challenge and persist with patience, of course. And we know that that's all required and essential for the neuroplastic changes to occur. And then another limb here. So the third one, this is the one that most of us are familiar with when we think of yoga. And that is the asanas, or the physical postures, or mindful movement. And we can either offer movement that's calming of the nervous systems or maybe challenging. We want to balance effort with ease. And we have evidence, I think we all know this, that tells us that movement is recommended for people with persistent pain. It can have an analgesic effect. It can influence our tissue health. It can obviously influence our function, our movement, and it can influence our cognitive and emotional state, and well, really every aspect of our existence, including our nervous systems. And then the fourth limb is pranayama, and we'll loosely translate that to breathing techniques. There's a little more nuance to all of these limbs, but for the purposes of this, we'll say they're breathing techniques. And many people report that breathing practices are really one of the most powerful and impactful aspects of their pain care. And many yoga therapists view breathing as foundational to effective pain care. And breathing can be a profound agent of change. It can influence our physiology. It can calm the nervous systems. Dr. Packham just talked about how important that is to, increase our the parasympathetic nervous system, or to regulate our autonomic nervous system, help to reduce the stress response, reduce body tension. This all may help to reduce threat messages. And there's many benefits from that, one which may be not just to change the pain experience, but maybe help us move with more ease. And then breathing can also influence our cognition, our emotions, and things like reducing fear and anxiety. And again, that can have a lot of different benefits, including resulting increased confidence, perhaps, to move. And then we also have to remember that the biomechanics of breathing can influence the way we move as well. So these are just some ways that breathing might contribute to changing the pain experience. And then we have the limb of pratyahara. We loosely translate this sometimes as interoceptive awareness, and these practices focus our attention on our inside physiological state. So things like body scans or breath awareness practices. And some of the helpful techniques for people in pain are self-regulation practices, regulation of emotions, thoughts, breath, body tension, because all of these can affect the pain experience, as we know. But we can't regulate what we aren't aware of. So these awareness practices, a whole host of different types, can be really essential as a first step to change. And I'm going to bring these next together, concentration and focus type practices. And then dhyana, that leads to then this effortless attention and meditation. And we've got a large body of research around meditation as associated with things like improved cognitive function and emotional regulation, immune function, sleep, relaxation, response, and a growing body of research on the positive effects of meditation on pain. You can look, I have resources at the end of this, but you can look at Fadil Zaidan's work on the effects of meditation on pain. So that's just a few. Again, we could speak about this, for years. And then the final limb is this idea of samadhi. And we may look at this as enlightenment, but to make it a little more translatable to and applicable and accessible to what we do in pain care, we look at this as a state of peace, or even purpose, or a sense of connection. And we have a chapter in our book about the existential concerns in pain care, and Marlisa Sullivan authors it, and she outlines numerous physical and or physiological and psychological and behavioral benefits when people have meaning and purpose and a sense of connection. And she talks about how that can influence one's pain experience. So there's your brief Yoga 101, and it's just one 8-limbed path. But yoga has the capacity to address many layers of an individual, and we can use many practices as portals into any aspect of one's existence, like I said. So just a reminder here, when pain persists, we know that all of these aspects of our being, of our existence, can change: physical, emotional, cognitive, behavioral, social, spiritual. And we can use any aspect of our existence to change any aspect of our existence. And that includes pain as well. So now I'm going to switch gears here and just talk about, there's a difference, a little bit of a difference here between yoga and yoga therapy. So yoga therapy, as defined by the IAYT, and there's a new definition now. It's just a little more detailed and lengthy, but this one, still encompasses the new one, or the new one still encompasses this one, and it's just nice and concise. So the process of empowering individuals to progress toward improved health and well-being through the application of the teachings and the practices of yoga. And so the operative words here I've highlighted: it's a process, so it's not a prescription. We don't do here's these 5 poses or 10 poses for back pain. We don't do, here's these 2 breath practices for depression or anything like that. It's a process, and it's empowering for individuals, and it helps to progress towards improved health and well-being. And this is the idea of salutogenesis. So yoga is based on this salutogenic process, which is an approach that focuses more on the factors that create and support health and well-being, rather than focusing on or addressing factors that cause disease, which is a pathophysiological approach. Both are needed, and it's just to say that yoga therapy is not based on the pathophysiological. So that gives you an idea of where the paradigm is coming from. And then just briefly, I want to mention the profession of yoga therapy. So it's not a licensed profession. It is a growing one. The International Association of Yoga Therapists was founded in 1989, and they do have a scope of practice. There's standards for training, accreditation, credentialing of therapists. Yoga therapy includes an assessment and a plan of care, and it can be delivered either one-on-one in individual settings or in small therapeutic group settings. And there is a peer-reviewed PubMed indexed research journal now. So I just wanted to, share that to just give you a sense of how this is different than, what you might think of yoga, doing acrobatics and what you may see in our society. And yoga therapists can be found in hospitals and rehab clinics and pain clinics and integrative rehab wellness centers, from primary care to tertiary care. And so this weekend, we heard from a variety of pain associations and organizations, which was phenomenal. I really enjoyed that, and different presenters, reminding us that we need approaches that help to address the complexities of the pain experience and address the whole person within the context of their environment that's inclusive to all people and cultures. And we know we need multimodal, cost-effective, evidence-informed, accessible approaches. So I want to take some time now in the last part here to talk about how yoga might be able to contribute to filling some of these gaps that we're currently facing in pain management. But before I do that, I just want to share a bit of background just to provide you with some context to this next section. So this, what you see on the screen here is a definition that was developed at the Integrative Pain Care Policy Congress, which was an event in 2018. It was held in Boston, and it was hosted by the Academy of Integrative Pain Management in partnership with the Integrative Health Policy Consortium and the PAINS Project. So this was in the US, and there were about 100 representatives from about 65 different organizations. And they all had varying expertise, of course, and all very dedicated to advancing integrative pain management. And they included people like different health care professionals and people with pain, researchers, policymakers, and so forth. And this was one of the things that they did, was they came to a consensus of this definition of comprehensive integrative pain management, or they use the term CIPM. And CIPM includes biomedical, psychosocial, complementary health, and spiritual care. It is person-centered and focuses on maximizing function and wellness. The care plans are developed through a shared decision-making model that reflects the available evidence regarding optimal clinical practice and the person's goals and values. And so a gentleman by the name of Matthew Taylor, he is a US physical therapist and yoga therapist and past president of the International Association of Yoga Therapists. He was the representative at this Congress for yoga therapy. And I guess he thought maybe he didn't have enough things to do. And upon reflecting after this Congress, he then recruited myself and other colleagues, Neil Pearson and Marlisa Sullivan, also physiotherapists and yoga therapists. He must have thought that we didn't have enough to do. And so he recruited all of us to co-author this white paper that was sanctioned by IAYT. And it was published this year in the IJYT. And it outlines some of the current problems in CIPM and how yoga therapy can contribute to addressing some of these problems, along with the supporting evidence. And we outlined also a list of recommendations. So that's the background, but I thought it was important to give this to you. So let's take a look now at some of the gaps that yoga potentially can fill that we included in this paper. So the first one I've already basically alluded to. Yoga can augment care. The framework of yoga and the practices can provide biopsychosocial spiritual approach to care where maybe only biomedical care is available. And yoga really provides this unique opportunity to include and address spiritual health. So if you remember those 8 limbs that I outlined, yoga includes body-mind activities like the movement and awareness and breathing and mindful meditative practices. And in addition, this spiritual component, integrating meaning and purpose and connection to self and to others, and even perhaps to a higher power that's in line with the person's particular faith. And if it's important to the individual to integrate their own religious beliefs and traditional spiritual healing practices and rituals into their pain care or into their lifestyle care, then yoga provides a space for that to take place. And then one more thing I wanted to mention on the spiritual health, I thought was really interesting, that we have some research that shows the spiritual aspect of yoga helps promote adherence to a consistent yoga practice or program. So in other words, it's been shown that people start yoga. So some of the initial reasons why they start it is for the physical benefits and or the mental health benefits. But then they stay for the spiritual benefits in some of the research that we have. So I just think that's interesting and helpful to know, because we know that the consistency of participation can be really important if we want to access the benefits, especially in pain management, and especially like what Dr. 𝐂𝐂𝐂𝐂 told us and Dr. Packham just reminded us about the importance of consistency in when we're looking for neuroplastic change. And then, of course, yoga can address some of the social determinants of health. And I just want to mention here about the group therapeutic classes that are offered in the community and online too, of course, nowadays. So this may help address access issues like affordability. So classes may be more accessible and affordable than individual services or therapy. And classes can offer social connection, of course, and we know how important that is. And even regular community yoga classes can offer a sense of belonging and integration into society, like this sense of normalcy. So people living with persisting pain, we're not always, and I would say often not, patients. We're not sick, we're not medically unstable. We're just people in society looking for ways to live well and to function with pain and to thrive. And persisting pain is already really isolating and disconnecting for people. So, maybe we can use community yoga classes that are, of course, safe and appropriate and what we call chronic pain informed, to be more inclusive of people in pain and allow that opportunity for that sense of belonging. And yoga can offer self-management strategies and practices that people can access independently and, on their own time, that are safe. And once they're learned, then they're free. There's no cost. There's no fancy equipment. You don't have to buy the expensive, the yoga industry now, of course, is a multi-billion-dollar industry. You don't need to buy any props. You don't need to buy mats or bolsters or blocks. You can use blankets at home and pillows. So just, keep that in mind as well. You don't need to buy fancy clothes. So an example of a free and easy to use practice would be like a simple breath practice or a body scan. And this can improve self-efficacy and give people some control over their pain experience. And we know how important that is. And again, just thinking of 𝐂𝐂𝐂𝐂𝐂's talk on the need and the value for neuroplastic interventions. And David Butler, who we all know, he always talks about finding ways to open up that medicine cabinet within us. And yoga can also offer a long-term supportive pain management option that's sustainable. It's a lifestyle practice. It can improve the individual's quality of life. And we do have some systematic reviews that support this. And so it's not it's not this, what I'm talking about right now, the long-term management. It's not a 6-month or a 1-year treatment program, although those have value. But what I'm talking about here, let me just back up for a moment. When you have these programs that are phenomenal, but sometimes what happens, the person is then discharged and told to continue to manage on their own, and they may not have that ongoing support. So it's just a reminder that we're currently lacking a lot of these long-term supportive services after these wonderful programs are completed. And then yoga practices inherently, and the philosophy, are inherently person-centered and valued, maximizing function and wellness. That's in line with the person's values and goals. And this is both, one-on-one therapy, which makes sense. But I want to give you a couple examples of how it can be even person-centered in a class setting. So in yoga, we often include guided meditations, and we use language and cueing that promote curiosity, that promote exploration and self-inquiry into one's own state, and help gain self-awareness and deeper insight into your own needs, and to help you be more discerning. So for example, a person might be able to become more skilled at knowing when to challenge their edge in that moment, or when they might need to rest. And this is a really important part of pain care. And then the last point here, you may be wondering, well, how does yoga therapy contribute to increasing pain literacy? We know that, that we do have a problem. There's a lack of pain literacy across all sectors. And although yoga therapy may not directly address pain literacy, I think we can use some of the yoga principles that can inform the process of improving pain literacy. So as an example, what is inherent to yoga is that it invites us to work towards more clarity with that curiosity and humility, and with non-attachment to our tightly held beliefs, which sometimes may be some outdated beliefs about pain. So yoga might lead us to continually work towards more clear understandings of pain, or of the science around pain and the lived experience of pain. And it asks us to reflect on our relationship to pain and what we think about it, and maybe reframing it in some way. And so in this way, I think that could be part of how yoga might contribute to addressing pain literacy. So a few more moments here just to speak to the research. And I really just want to point you to these two resources. So this first one is open access. It's the white paper that I was talking about. And we have provided a really extensive commentary of yoga therapy's evidence base with the citations attached to the paper. And this one is the chapter in our book that Rob talked about in my bio. So this is Dr. Stephanie Munaz, and she is a researcher. She does some research at Johns Hopkins, and she wrote the chapter in the current research in yoga and pain. And she has a very nice review there. And she does include the systematic reviews and meta-analyses that we have currently on yoga and chronic pain. So I wanted to share this slide with you just to show you some of the level of evidence we have. And in particular, these specific ones, you can see here on the screen, for chronic pain, chronic low back pain, neck pain, fibromyalgia, and RA and OA. And so as promised at the beginning, I would try to harness my passion and not overstate claims of, there's a lot of work that needs to be done in yoga research. It's not, the rigor needs to increase. I'm not a researcher, but I'm learning more and more about research and learning to read about the gaps and limitations. So we just don't know, enough. We don't know which practices are most effective. We don't know who, what, where. We don't know dosage. We have no idea, or we can't say, what the underlying mechanisms are. Yoga does appear, however, from, these systematic reviews and meta-analyses, which is nice to have that level of evidence, that yoga appears to be consistently associated with improvements in pain and disability, emotional health, and quality of life in chronic pain or persistent pain populations. And it appears to be safe, and we know that that's really important. So I hope that that sheds some light on how yoga therapy can serve as a valuable part of comprehensive integrative pain management. And I wanted just to summarize here with this slide. I didn't really explicitly say this, but just kind of a summary that yoga therapy in pain care provides a philosophical framework, and it provides also individual practices and techniques. And the three orientations we can use it, it's for professionals to share with people in pain, but it's also for people in pain to practice on their own or in a group setting. And then I didn't mention this at all, but it's, yoga therapy is also for professionals and their own personal practice. And so that's a whole other topic, but that is part of the yoga journey. So finally, the next steps on, how you might safely recommend yoga or yoga therapy. And, I wish I could just give you a few sites and say, go look at these, and these are where you'll find, the best yoga therapists that can help you. But it's not that easy. Just like with finding any rehab professional or physician, it's every person is different, and everybody has a different skill set and level of knowledge about pain. So, but I did think of a few things. So number one is just really get to know your yoga community. And that takes some time, but it's worth it, I think. And just come right out at asking about the person's training and their experience. You can say something like, tell me about your experience in working with people in pain. What are the most valuable things you have learned about pain and pain care? Asking questions about their continuing education around pain specifically, and just getting a sense of what the person knows and where some of their gaps in the knowledge might be. And then also asking, about if their services, if their classes or their sessions are chronic pain informed. So is a specific class for people in pain, or is it a regular class that is accessible and inclusive to people in pain? And if so, just get them to share with you maybe how. And by listening, I think you can kind of get an idea, of their approach and the language they use. Do they understand the complexity of pain, or do they have linear approaches that, for example, focus maybe just on alignment, as a solution to pain reduction? Or are they able to look at the whole person? Is it more tissue centric or physical centric? Or is it more psychological or neurocentric? Like, are they saying more that it's about just the meditation and that we can transcend the pain, and we're working just on maybe top-down approaches? So, just looking at, does the person have an idea of that pain is complex and that we can use all these different approaches? And then I would also say to share resources. So if the yoga professional is really curious and open and very humble and they want to learn, then you can help them learn, send them some of your favorite pain resources. We have a ton here this weekend. I share, of course, Pain BC spoke on, I think it was Friday, and I share a lot of resources from there. And you see on the screen here, paincareu.com and paincareaware.com. So disclosure here, those are the two sites I work with. Pain Care U, I teach courses for healthcare professionals about integrating chronic pain informed yoga into their practice through Pain Care U. And then soon launching, we are also developing Pain Care Aware, which is for yoga teachers to help develop more chronic pain informed classes. So you can use those as resources, and eventually we'll have directories on there. And then the iayt.org site is where you find the directory of yoga therapists in your community. And then finally, you can just contact me. My website's below, and it's easy to find me. And of course, I don't know every yoga professional everywhere, but I've been doing this for 22 years, and we have thousands. We have a large community of practitioners who are integrating yoga, like I said, into their rehab practice. So we know someone who knows someone who knows someone who might be able to find that perfect fit for the people you work with. And then if you want to learn more, these are some resources. So you have access to these slides if you like. So there's some books here that I would recommend. The first two are specific to pain, and of course our link to the white paper. So I've got 2 minutes to do a breath practice. And this is perfect. You can think of this as you're in a busy clinic setting, and how can you just bring someone present and become aware of their breath in just a couple minutes. So I'll just end with that. So a nice little break too for you. So if you want, you can close your eyes. You don't need to look at me. or the slides. I'm not going to be doing anything exciting there. Just listen to my voice, and you can just stay seated and eyes opened or closed, and just bring your awareness to your breath and check in and notice the rate and the pace, the depth, the length of the inhale and the length of the exhale. And if they're different or the same, you don't have to change anything. We're just noticing. Notice if there's any spaces in between the inhale and exhale, or if it's one continuous motion. And notice if the breath is rigid or bumpy or smooth or soft. So really just any qualities. And remember, we're not changing, we're just noticing. And if you lose your focus, that's fine. To celebrate the fact that you notice that your mind was wandering, and then just come back to the breath. Maybe you can hear the sound of your breath. The temperature as it enters and exits the nostrils, or the mouth if you are breathing through the mouth. Perhaps the air is a little bit drier and cooler on the inhale, and a little more warmed and moistened on the exhale. And then notice how the body might be moving or responding to the breath, and any sensations that you may be feeling. And just relax and shake it out. Open your eyes if you feel ready, and do what you need to do. And